Hi, Marine Rescue Hawkesbury. It's Phil here. We've got the latest tips and tricks for you, and it's in relation to our new oxygen therapy cylinders and regulators. So you're all familiar with our current system. This is what we're all trained on in our Advanced Resuscitation training course. So we have a C-type cylinder with oxygen. We know this because there's a label on it that says medical oxygen compressed. And we'll also have a separate regulator with a pressure gauge. And the flow meter is set with this dial on the end. So you're all familiar with this. And this sits in our oxygen and defib bags. These are the blue bags, which are sitting on our two rescue vessels, as well as the one in our ready room on the base. So I'd like to introduce to everyone the new cylinders that we are transitioning to across the state. It is known as the BOC brand Inhalo system, and Inhalo system introduces something a little different. So these cylinders here are approximately 490 litres. The new Inhalo system is here. So the most noticeable thing on this cylinder, whilst the cylinder is the approximate size, these cylinders can actually hold approximately 20% more oxygen than the old cylinder. So these ones are now 630 litres. The other key feature of the new Inhalo system is that it comes with an integral regulator. That means that every time we swap this cylinder when it's expired or empty, is that we get a new tested regulator that's attached to the cylinder. So we exchange this entire unit rather than disconnecting this regulator. So you can appreciate by having this in every cylinder change, we don't have to actually service our regulators anymore. The typical service on these was annually, and that reduces costs significantly, but also reduces the risk of assembling incorrectly. Is this done up tight enough? Is the O-ring in there? So we've had to keep spare O-rings as well. So this new system is super convenient, and it's going to reduce our running costs. So the entire marine rescue units across the state are slowly transitioning from this. And maybe just a key note there is that whilst you're trained on this, and after this you're going to be trained in terms of how to use the Inhalo system, ultimately we need to be able to know how to use both. And like all first aid training and advanced resus, is that we should only be practicing what we've actually been trained to do. If our training has expired, then it's not suitable or appropriate for us to actually be administering oxygen to patients. But it is the controlled medicine, so to speak. It's regulated by Therapeutic Goods, or TGA, Australia, which means that all these labels are all regulated. We shouldn't be modifying any of these labels. So you can also see that the labelling is a lot clearer, because before you administer any gas to a patient, you should always be checking the label. Is it the appropriate gas? Is it the correct gas? And these should say medical oxygen compressed. And you see this label is just like the label on the original bottle. It still has the same labelling. So a couple of features on this new bottle. It has a carry handle, makes it super easy to lift. It will fit into the bags, but it will fit into these bags. So that's also super convenient. And there's nothing jutting out from the bottle. You can see this is jutting out, so there's risk of damage, and it can make packing around a little bit more difficult. So a couple of features apart from this carry handle. We have a cover here which is equivalent of the white tape which designates a bottle that's been unused. So this has a pull tab, which once it's removed, it's exposed and left exposed. This cap is a throwaway cap. We have a pressure gauge, which has, it's marked in green, yellow, red, which is the overall content of the cylinder. Obviously this one showing at the top of the green being full. We also have a grey hinge cap here which hinges down, and this exposes two types of outlet. We're familiar with the one that some nickname fir tree, but it's essentially a barbed fitting. So when we push the oxygen therapy mask tubing onto this, it's going to grab on and not slip off so easy. So sometimes they're nicknamed fir tree fittings or barb fittings. And the second one is a sleeve fitting. This is what's common in hospital settings. Marine rescue won't typically use this lower fitting or outlet. We'll typically use this upper fir tree or barb fitting. So that's underneath this cover, and it's simply covered over when not in use, which just avoids things from getting into the outlet. And then the other feature is the flow valve. So it's a dial on the old one, it's still a dial on the new one. So on the top of the bottle is this grey dial, and it has a little window on it which at the moment is 0, and you can dial this all the way so it reads 15, as in 15 litres per minute. So the way that we operate this cylinder, firstly, we know this is a brand new cylinder because it has this safety cap on here and it says remove before use. So we'll simply pull this ring tab here, then this is just thrown away. So whilst this could be theoretically tested, whilst it's in operation on a vessel, we might test it and we would then close off the valve and would of course monitor the volume or the contents, because obviously if this starts to drop off too much, we may want to swap the cylinder out to just ensure that there is enough oxygen here to use when we really need to use it on an actual patient. So we can monitor this needle. So whilst you might find a vessel with this cap missing, as long as the valve is in the off position and the gauge is still reading full, it is still a serviceable unit. If this gauge is not reading full, please check with operations to ensure that an adequate level of oxygen is maintained before the vessel makes way. So before we switch this on, so we're just going to ready this. We've pulled the safety cover off. We're going to pull this cap down to expose the outlet fitting, and we're not going to turn the main valve on. So has very clear markings. You've got off in red, on in green, and you've got a little window that says off. Before I turn this on, I'm going to check the flow valve. So this is no different from our existing training, is that the flow valve should be set to 0. If it's not, just dial it till it shows 0. Then this tap is simply rotated in the direction of on all the way, and it says on this window. Now, this is the second generation of this design for inhalos. There is also a first generation, and it doesn't have this discrete tap stop where you can just turn it all the way on. You know the first generation it has black knobs, and with those you have to turn this knob slightly back after you fully open it. But most of these you'll get now are the second generation, which have the grey knobs, and you simply turn this on fully. The instructions that will come in each defib and oxygen kit will come with this sheet, and this sheet has the Inhalo Gen 1 operating instructions on one side, and on the other side is a Gen 2. And today I'm showing you the Gen 2, which again has the grey knobs. Okay, so I've turned the main tap on. Before I open the flow, I need to connect my mask. So this is my oxygen therapy mask. I've got the standardized fitting on the end. I'm going to attach it to the upper barb fitting. So you push that on, check it's secure, apply the mask to the patient's face. Again, that is all according to our advanced resuscitation training. And then you will turn the flow valve to, let's say, 15 litres a minute. And we can hear the oxygen hissing now. It's now flowing at 15 litres a minute. Each discrete setting is clearly visible and marked through the window on this knob or dial. So the first click, for example, says 1 litre a minute. So to disconnect, always turn it back to 0. And then you can remove the fitting. Typically, our masks are all single use, which means that after it's been used once, it's thrown away. Then this valve, the main valve, is turned clockwise in the direction of off all the way until it stops, and you'll see that off is showing through the window on the knob. The grey cap is returned to the closed position and it's ready to use again. So these cylinders, of course, just like the old ones, it is only in gas form. There is no liquefied version. It means that these can be used horizontal or standing up. So it doesn't matter the orientation of these bottles. These will still be used inside the bags. You will not normally have to remove these cylinders from the bag. They're mounted in there. So if there's any questions, just see your trainer, your first aid trainer, and they'll provide you with more insight. We can also write to the training officer email if you want more questions answered. And we're also providing one of the units, so this one that we've now removed the safety cover, this one we're going to maintain in the training room so that people can learn how to actually use this. And once the unit has been trained on the Inhalo and we've released this video to our unit members, then we'll start to make the transition firstly on our 2 vessels, and a little bit later then we'll be doing the base one. But just be wary that you might see either of these cylinders in our unit, but we are going to be transitioning all of them to Inhalos, including our spare bottles. So that will happen over a course of a few months. All right, thanks everyone for listening. Hope that's very helpful for you, and we'll see you again. Thanks.